Why are you stretching that arse out?
Because that's how it's gonna be, right? When you do anal. Imagine, that's what it starts like. And by the time they've put it all the way in, it's gonna be like that, isn't it? Because the dick isn't gonna shrink once it goes in. Fucking hell, could you imagine? My name is Chloe. I'm from South London. I'm a bus driver. Well, I used to be a bus driver. I recently just quit. I just thought, do you know what? Live your dreams. Now I have no job. I have an 8-year-old daughter. She's my best friend. She is just the best. Imagine me, but just mini. She's like my little pocket rocket. Have you had anal?
Yeah, I've tried. I wouldn't say I've had.
So what does that mean? Like,
I've tried.
was it just the tip?
I don't know what went in, but something.
What?
I like when like you're having sex and then he puts like his finger up your bum. That's nice.
Yeah, mate, that's standard procedure. Like,
Yeah.
I cannot be with a girl that doesn't do
She
that.
said standard procedure. After having a child, I think everything's just been exactly the same. But then they did stitch me up because it ripped the whole way from front to back. It's like I got like a little neat, what were they called? Designer vaginas. Not that it was messy before, it's always been neat, but neater.
Why are you here today?
I just want some information about certain sex positions, because I find like certain positions hurt. Do you know what I mean? So I want to know like what can I do to help that or prevent it. Oh. I want to know if I can do things differently or if I should try like other positions, like should it be hurting? You know, just get some knowledge. Hey.
Hello, Chloe. How are you?
Hiya. You okay?
I'm good, thank you. Have a seat for me.
Thanks. You look nice.
Thank you, so do you. I like your
Thank
hair.
you. Oh God, I need to wash it. Let's not go there.
No, it looks lovely, so that's all that matters. And what brings you into the sex clinic today?
Wanted to know about like certain positions. It really hurts.
Okay.
I'm having sex, so I'm not really sure like what I'm doing wrong or.
But is it all positions or is it certain positions?
It depends if my legs are out wide. I don't know if it feels like it's pushing on something or.
You feel like it's kind of like you can't go any further and then it's sort of painful?
Yeah.
Okay. So you don't have any abnormal bleeding after sex?
No.
No, okay, fine. I might want to do an internal examination as well, but the fact that it only happens in certain positions is reassuring to me. I think in terms of tips and tricks of trying different positions, I'll refer you to our sexpert, Jess, because pain during sex is not nice, is it?
No, it's not.
No. When was the last time you had any sexual contact?
5 days ago.
Okay. And what type of sex did you have?
Missionary?
No, not position. In terms of, was it vagina, was it anal?
Oh, yes, yeah, vagina.
Vaginal. And do you ever have anal sex?
Yeah, sometimes.
Yeah?
Yeah.
Okay. And do you use protection?
Don't use condoms.
Reason being?
I just don't like condoms.
So you never use condoms? No. Okay,
No.
fine. Was it with somebody you know?
Ex-boyfriend.
Ex-boyfriend.
I'm actually having sex with my ex-boyfriend. I know, recipe for disaster, but better the devil you know, right, than someone you don't know. And it's good sex, so.
And if you're not in a long-term relationship with him, how come you're having unprotected sex?
I'm on the pill.
Okay, so the pill will stop you from getting pregnant,
Yeah.
but it won't stop you from getting an STI?
Yeah, I know, but he gets checked regular. I know.
Chloe. Right, no. We need to start wearing condoms, okay?
Yeah.
Unless you're wearing condoms, your risk is going to go up for infections. I think it's worth doing a sexual health screen today. I'll do a blood test for HIV and syphilis just as routine.
Okay.
And I'll do some swabs for chlamydia and gonorrhea from your vagina and from your back passage.
Okay.
All right?
Okay. I wasn't expecting you to say that.
Okay, Chloe, so just relax your legs back for me. Well done. Any pain or discomfort there?
It tickles.
It tickles, but it's not painful, yeah?
No.
Fine, that's all that matters. Everything looks normal and healthy there, okay? There's nothing there that shouldn't be there, okay?
Okay. I've had one STI in my life. I know, sad times, right?
First swab coming up for chlamydia.
I don't really get STI tested often. I think I've had like 4 in my life.
And second swab for gonorrhea.
I think I'm lying to myself. I like to live life on the edge.
No, do you know what though? Yeah, when you have drunk sex, which happens to me a few times, it's just like it's so good, and then you wake up and you forget it.
Yeah,
That's
like
so
in the moment,
shit.
you know that it was great
Yeah,
in the
innit?
moment,
But I
then
find when I have drunk sex, I am talking loads.
yeah, I feel like I feel
Oh,
like I do
baby,
the
yeah.
most. Yeah.
Chloe's been called in to see sexpert Jess because she's had pain during sex.
Certain positions hurt. It can hurt sometimes. I feel like, I don't know if they're pushing on the wrong bit or am I doing something wrong? You know the one where you have like your feet kind of up here? That one, when they're really pounding, oh, that one's not for me at all. No, I don't like that.
Hey, Chloe.
Hey.
Come and take a seat. Make yourself comfy. So, what are you here to see me about today?
Just to get a bit of knowledge on different sex positions, like some hurt. Is there things I can do about that?
So, tell me a bit about the sex you're having now.
It's just really spontaneous.
Okay.
You know, like it's never planned, it just happens. Nothing better than a quickie. You know, like a morning quickie before work.
Nice start to the day.
Yeah.
Okay. So, what's your favourite sex position?
I think missionary.
Yeah?
Yeah.
Why do you think that?
Because the legs are at an angle, but they're out. It can go in, like, deeper.
And is that something you like, sort of deep penetration?
But yeah, but not fast.
Okay.
Because when it's like too fast, it hurts.
What about foreplay? How do you feel about that?
Sometimes I don't feel like foreplay is necessary.
Do you allow time for foreplay during your quickies?
No.
Okay. Now, something that not a lot of people realise is that the vagina grows just like the penis does when you're aroused. So foreplay does more than sort of simply get you wet. What it actually helps to do is it will extend and sort of elongate your vaginal canal. So it moves your cervix up out of the way, which is a very sensitive area, which I think is what you're describing when you're finding the pain. It's where the tip of the penis is sort of bashing into your cervix. And a lot of women find that oversensitive and too painful. So if you allow some time for foreplay, what that will help you to do is get your body prepared to receive a penis.
Okay.
So I think, with a little bit more preparation, you'll actually be able to enjoy more positions. And perhaps some of these positions that currently feel a bit deep, you may actually be able to revisit as long as you're dedicating enough time to foreplay. That's going to reduce this cervix bashing, because it's a very sensitive area.
It is, yeah.
And
you know your stuff.
I try to.
She said that sometimes there's not enough foreplay. If I do the foreplay, I'll be able to handle those positions better with ease and won't be hurting as much. I think my sex life is going to be 10 times better with this advice. Well, it needs to be. So, fingers crossed. Are you nervous about the results?
I think I am a little bit now, yeah. There's been a few moments where I've been like, you probably would have something. And it's like, no, you haven't. Like, if I do, I think...
You keep going back and forth,
I think I don't quite know how I'm going to handle it if I do. Like, but I'm trying to tell myself I'm confident, but I'm actually not.
I was confident until you said to me, you never know. Yes! Hey!
Hi, Chloe. Welcome back. How are you feeling about your results today?
I was really confident earlier, but now I'm feeling a bit nervous.
Okay, so I won't keep you waiting, Chloe.
Okay.
So obviously we did a full sexual health screen.
Yeah.
So we checked you for chlamydia and gonorrhea with those swabs that I did, okay? They both came back as negative.
Okay, good.
Okay, so that's good. We did the blood test as well, and that checked you for HIV and syphilis. And they both came back negative as well.
Why did you pause like that? Oh my gosh. Oh, I'm so happy. You did make me scared, I'm not gonna lie.
Well, good, that's what I want to do, yeah? Well, that is true, because, if you carry on having unprotected sex, that just puts yourself at risk. All right, Chloe, well, you know where we are now.
Yeah.
If you ever have any questions, any concerns, come back to the sex clinic.
Okay,
All
thank
right?
you.
Okay, darling. Get home safe. All the best.
See ya.
Take care.
Bye. Negative. So that's good. So at first I was fully confident, but the longer I waited, the more I thought, oh my God, could you imagine? It was really useful coming in. I've learned so much, things I never knew before. been really informative. Just because the person I'm having sex with gets checked, it doesn't necessarily mean he hasn't got anything, which I didn't know.
No, nearly died there.
She said I always need to use protection, which is a bit of a bummer, but I guess I don't want to catch anything. So it's just something I'm gonna have to do.
Doors closing.